Hello, I'm Dalton Delan. I'm a columnist for the Berkshire Eagle, and this is Eagle Reels, where we take you beyond the news. My guest today, an investigative reporter for the Berkshire Eagle, Heather Bellow. Hello, Heather.
Hello. Thanks for having me.
Thank you so much. Heather, you've done extensive reporting on nursing homes, obviously with a focus on the Berkshires, where from your reporting, Williamstown Commons home had in 2022, $47,000 fine. Another home in Dalton, Massachusetts had a $45,000 fine. In that case, there was at least one death attached. On the national front, during the COVID pandemic, 184,000 deaths in nursing homes and other long-term care facilities took place, and that was at least a third of U.S. COVID deaths. I'm not trying to overstate that case, but I'm wondering, from your perspective as a reporter, is there a connection between what we'll get into here, conditions in nursing homes, and that this can lead, not only to care issues, but even to death? A little sense from your story, your perspective.
Well, what we saw during COVID was sort of the tip of an iceberg. There was so much going on before COVID that experts believe made nursing homes and nursing home residents and patients susceptible to this virus. Obviously it's a very vulnerable population, so they were going to be susceptible anyway. But excuse my beeps here. But they, but they were creating conditions in which there wasn't enough staffing, and so already they had staffing issues that we've documented, that the staffing problems predate the pandemic by at least a decade, and so they had already had this environment that was just ripe for a disaster, and. Yeah, we've written some stories about the aftermath. There was one director of nursing who sued one of the companies because they fired her for reporting some of the problems. I mean, all the problems just continue to stack up. And then what it did was it sort of opened up this whole world of what goes on inside nursing homes to the public. And we just started to continue to report on it, continue to follow what's going on at each of the homes in the county, and it is the county is just a microcosm of what's going on in the rest of the country. It's not unique to the county.
Heather, what you just told us, that's really important. You're saying that the conditions that could have exacerbated, let's say, deaths during the pandemic, they were precedent. They preceded the pandemic. You said it by at least 10 years. Just to talk about the Massachusetts issue, 3,000 beds can't be filled. Because of staffing shortages. I suppose we could say it's better that they not be filled if there are staffing shortages. And there are 8,000 vacant jobs. Can you unpack for us a bit the reasons for these conditions in nursing homes?
Well, I think it's very complicated. I think that our lawmakers are trying to unpack that. They're trying to figure out, do we give the industry more money? The industry is asking for more money from taxpayers, essentially, to help them because they're saying we're not getting enough Medicaid reimbursements. We're struggling. We're struggling to find staff, and we're struggling to pay them. And the underpay issue is big in all of this as well. And so I think the regulators are doing the best they can. They're also understaffed, and the industry is looking for help. But lawmakers are starting to say, well, wait a minute, where are all your profits going? Because that's something that doesn't get readily released in the standard reports. You have to dig for that information, where all the money is going. And there are these things called third-party transactions where, nursing homes have been known in some cases, and there have been investigations in other newspapers about this, have, hidden profits in companies that they own, essentially. And it's not all getting, laid out on the table in the way that everybody would like to see. So the vacant beds and the lack of staff and all of that is a complicated problem. And I think the question is, should the industry be getting that money, or should they, or should the lawmakers have a hard look inside their budgets and their profit system? So.
Yeah, you brought up, Heather, that important, that Medicaid shortage. I'm told that could be on the order, let's say, of $27 a day for a resident, the underpay. And you ask yourself, okay, what does that result in? Now, I'm not asking you for a judgment, but as a reporter, does that mean corners have to get cut? I mean, no one is in business to lose money. What does a nursing home do when it's not being reimbursed sufficiently?
Right. When it's not being reimbursed sufficiently, or as other experts say, are keeping profits, maybe not hiring, maybe understaffing. We're not really sure exactly, but and I would never, profess to know in any specific case what's going on. But yeah, corners are obviously getting cut. Otherwise, we wouldn't see all the fines racking up the way we see them racking up in nursing homes across the country, but also in Berkshire County. They're, everything from they didn't get a bath for a month to their toenails are, 2 inches long, or, something like that. Or much worse outcomes, deaths from what appear to be neglect. Somebody didn't watch someone who was not supposed to eat without help, and they choked. Another person wasn't being monitored. And then when they had an emergency, the response was not what it should have been. So we see these things all the time, and I get phone calls at least once a week from somebody who says, this is happening at this nursing home. Something is happening. It could be a friend or a parent, or they heard something. So this is very common, and I imagine it's very common across the country as well.
Heather, what role, at least in your reporting, did consolidation in the industry play in my own family? My mother was in a nursing home in California, and it was a single nursing home, and everything was going well until it was bought up by a chain. And in that consolidation, the moment my mother had a one-day ship out for a little acute incident to a hospital, the nursing home, we won't get into this granular thing, but they don't have to accept a person back. And they used that because my mother needed a little more attention than perhaps some other residents to not accept her back. She went on to go to another nursing home that was really good and so forth. But the point is, at the time, I thought it was the basest of tricks done completely because of consolidated money, industry coverage, and it put profit before care. Is that new to you, or have you seen any of this industry consolidation and how that plays out? Sort of like maybe family farms now are no longer part of combines. Does that affect the situation?
Yeah, I have heard of, and I don't think that we have any private equity ownership in Berkshire County of nursing homes, but I have heard that nationwide that's been an issue. That I think there was a study that found that the nursing homes that are owned by private equity are actually not doing so well, that they tend to have more problems. Maybe they're making more money, but their residents maybe aren't doing as well. I think that's what that found. I don't have it right in front of me, but I think that might be a problem. I'm planning to do more work on the financial aspects of all this, where the profits are going. I'm really curious about how that works, about third-party transactions and all of that. I haven't done enough of that yet. I've read other investigations. But I think money is behind a lot of this in some way.
Heather, you have an investigative reporter's skills. You know where to look. You published, the paperwork of the investigation report into the Williamstown Commons and so forth. Let's say one of our viewers, just citizens, just a family, someone considering the need of someone in the family to go into a nursing home. Can you point us, the rest of us who are not investigative reporters, what can we look for? Where should we look to know if this is a home that does or doesn't have a lot of issues? And then if I can, after you answer that, can you also let us know after admission, how can we look at things? How can we tell if there are problems? Could you give us some guidance?
I think so. And, my parents are elderly too. And we're so far, nobody's had to go into a home, but this has been on my mind. Like, what if this happens? So definitely the Centers for Medicare and Medicaid, their website, CMS, is where you find all of these inspection reports. Once they get posted, there's a delay in, when there's an inspection of a nursing home, which the state does, then it goes into the federal database, and then it eventually shows up on the CMS site. So you can see what penalties they've had. You can see their staffing ratios. You can see, you can actually, download the inspection reports, the kinds of things that I look for, and sort of go through with a fine-tooth comb to see, what exactly happened. And so I think that's good. I have been told by some experts that the rating system is not really it's a 5-star rating system, that it's not really the best way to judge it. That can be true. I mean, certainly 5 stars is great, but it doesn't always tell you the whole story. So you got to look deeper into each nursing home's CMS page, and then I think reviews on Google can reveal quite a bit. You may have a lot of really good reviews, but then you also might find a few things in there that might warrant some further inspection. And then I think in terms of if somebody's in a nursing home, what I've heard from relatives and residents and pretty much everyone is just to really closely monitor them, just visit as much as possible, and just have a real role in what's going on. it depends on the nursing home, and it depends on how, on the culture of each nursing home too, and what they will allow and tolerate in terms of family members, coming in and demanding things. So
you mentioned both the CMS site and also, Google reviews. If a viewer has a family member in a nursing home and they think there are issues, could you enumerate, if it were you, obviously you could talk to management, you could talk directly to the nurses. Do you threaten or use social media? Is there a way to go to the CMS site? What should a person do if you want to actually address an issue you perceive?
If there's a problem, so the state has a hotline. They will investigate anything. It takes a while. I've heard, this is just based on what I've heard from people with family members, and over the last 3 years, it can take a while to get through. There's a lot of red tape sometimes. That's at the state level. I think, they've got their hands full, obviously. And then there's the local ombudsman, which I think I've heard mixed reviews about that. They're all part of the same industry in a way. Even my understanding is even the regulators to some degree are still within this industry. So it's complicated, but I think, you definitely, you would want to go to the regulators. You would want to go to the state. You can file complaints, and also the local ombudsman. And what people tend to do is call the newspaper.
There you go. They can write you.
Yes.
So you mentioned you have family members. You've thought about it. Knowing what you know from your reporting, would you have great trepidation, or does it just vary tremendously and people should, look at each home? Any guidance you would give us thinking about nursing homes? Yes, it has, it is something that I've had to think about. So far, we haven't had to do that, but I also want to differentiate between a nursing home and an assisted living facility. Those are two different things. And I think, I think to your question about what I might do, I'm not sure. I think what's difficult in so many families is that, especially if parents have, conditions or dementia, or, you have to be able to take care of them at home, and if you can't do that, and sometimes they medically can't be cared for at home, then what do you do? So, and there are incredible expenses involved in a lot of this if they don't qualify for Medicaid. There was a New York Times article about this just the other day. People who are caretakers and really losing a lot of money doing that. So I think it just is. It's a case by case situation. I feel like the ideal is to be able to have people at home and cared for at home with if possible, some kind of visiting healthcare system, or, but not everybody can do that. We're in a pickle, as a society, because we don't care for our elders in the traditional ways anymore. Our society has changed. So it's definitely a question, and everybody is thinking about it and talking about it. Whenever I talk about, the struggles that I'm, facing, that my parents are facing, they say, "Oh, I'm going through the same thing," or,
my friend is going through the same thing. And let me tell you this story. And it just continues to be a major sort of crisis. So,
Heather, finally, I don't know if your scope went this broad, but I know from friends and relatives that have gotten health care, including this kind of care, nursing home care. For example, in some European countries, France would be one, and so forth, where the experiences are generally much better. Anything finally that you can tell us? Should, those of us thinking about priorities as we vote and as we write or speak to our representatives about what we can do on the broadest of scales, and what should we be aspiring to versus markers set elsewhere in the world?
Well, I read about this dementia village in Europe. I think those types of, that to me sounds really ideal, and also this sort of communal housing, anything that can keep people in a dignified and warm and nurturing environment, instead of an environment where you're among strangers, there are not enough people to really help you. And, when you hit the call button, it could be, hours before anybody comes in, that kind of thing. So yeah, I think I love those ideas about, with the dementia village really intrigues me. And I know that, I think in terms of what lawmakers are doing, I don't know. I'm not sure. I think we have to look and see what our government is working on, and try to support that if it's something that looks good. I don't know how we're going to sustain this model.
Thank you.
I don't know what's going to happen.
Thank you. Heather Bellow, thank you for your investigative work, for opening your notebook for us today. And viewers, thank you. If you are already a subscriber to the Berkshire Eagle, thank you so much. If you are not yet, please consider becoming one. That is how investigative reporters such as Heather Bellow do the work that they do and that I do. I'm Dalton Delan. I'll see you next time on Eagle Reels and in the pages of the Berkshire Eagle.